and welcome to The Comprehensive Dentist. My name is Dr. Jason Bullock, or Dr. B for short, and today we're going to be talking about dental implants. Now, if this is your first time to this channel, The Comprehensive Dentist, it's an educational entity originally started to provide dental education to dental providers. While we still will provide education to other providers, you are currently watching our patient education series designed to educate dental patients on various topics in dentistry. Now, with that being said, let's talk about some dental implants. It seems that many patients have heard of dental implants, but I seldom meet patients who really understand the details of what it means to get a dental implant. Now, if you are currently missing one tooth or many teeth, dentistry offers many options that can help you fix your bite and your smile. The three big options that are available and commonly used are a removable prosthesis, a dental bridge or fixed prosthesis, and a dental implant. Now, of course, there is always the option to do nothing. And many patients don't always consider this option, and truthfully, many dentists do not either. Anytime you have a tooth removed, there's always a chance that the surrounding teeth could shift or move over time, changing your bite and your appearance. Dentists have no way of predicting if this movement or these changes will happen, and in some cases we see no changes to the remaining teeth at all, and in other cases we see large amounts of changes over time. If you are someone who is only missing one tooth in the back of your mouth, such as like a first molar or a second molar, you may not see any changes in your bite, your ability to eat, or your smile. If this is the case, you always have the option of doing nothing and just maintaining what you have. Personally, I think dentists sometimes oversell dentistry and the need to replace teeth. If you're not sure what your options are for your specific situation, I would encourage you to make an appointment with your dentist, have a thorough exam, and get their opinion. Some examples of a removable prosthesis are a complete denture for someone missing all their teeth, or partial denture designed for someone missing one or more of their teeth. Now, in some cases, you can even have a combination of the two. In some individual treatment plans where you could have a complete denture replacing the top or maxillary teeth and a partial denture replacing a few teeth on the lower or mandibular arch. For more information about dentures, we'll probably likely need to make more videos on this topic in the future. If you think an information video on dentures could be useful for you, please let me know in the comments below. Another common option to replace one or more missing teeth is a dental bridge, professionally called a fixed dental prosthesis. As the name implies, it is fixed or always in the mouth, in stark contrast to the denture option that is removable and should be removed daily. For simplicity, think of two crowns over existing teeth on each side of the missing teeth space. The teeth that serve as anchors for the bridge have to be cut or modified so a crown can be fitted over the remaining tooth structure. Attached to these crowns are fake or replacement teeth that fill the missing tooth space. Again, for more information on bridges, we likely need to make a video on this topic in the future. Again, if you think this video would be useful or you find it like something you'd be interested in, please let me know in the comments down below. All right, now that you have some context, let's talk about dental implants. Dental implants are essentially metal screws that are surgically placed in the bone under your gum tissue. One thing to keep in mind as we dive deeper is that treatment approaches and techniques can vary per provider, location in the mouth, and individual considerations for you and your present oral condition. One of the most common approaches is a four-part process. After a thorough examination and plan has been made, the first step is to surgically place the implant. Once the implant is placed, it holds itself in the jaw much like placing a threaded screw in a wall or a board would hold itself. A screw or healing cap is placed into the implant to prevent gum tissue or debris from getting inside the internal of the implant. Immediately after the surgery, you will most likely have some stitches and you may experience some swelling and discomfort. After the implant is placed, it must be given time to heal, and during this healing process, the bone around the implant remodels and attaches itself to the implant, a process we call osseointegration. This healing process allows the implant connection to the surrounding bone to become much stronger over time. This healing process can last anywhere from 3 to 6 months. After enough healing has occurred, the dentist will then go back in and uncover the implant. This is the second step in the process. This requires a small surgery to regain access to the implant that has been covered and healing. The dentist will then place a healing abutment or a post into the implant. The soft tissue around the implant then begins to heal around that post or abutment and shape the opening of the implant. At a third visit, the dentist will begin fabrication of the crown that will attach to the implant. This typically involves an impression of the area, and your case will be sent to a dental lab for fabrication. Although some dentists may do digital impressions or make the crown in their office. The finished crown will then be seated at the last and final visit, allowing you to leave with a brand new tooth. Now keep in mind that there are variations of the above described process depending on your provider. There are also situations where an implant may be considered prior to losing your natural tooth. You may have heard or read about immediate implants, where the dental implant is placed on the same day as the existing tooth is removed. Now this is beyond our discussion here today, but those are sometimes options as well. Make sure you understand the process when committing to getting a dental implant and have in-depth conversations with your dental provider. I will also mention that dental implants can also be used to anchor dentures and bridges, but that is more information for another day and another video. Because the dental implant itself is placed surgically and essentially replaces the root of the tooth, a crown can be anchored or attached to the dental implant, giving you a replacement tooth to fill the missing space. This means that the dental implant is really the closest thing that we could use to mimic a natural tooth. This is also nice because it means that the only area that dentists ever really work in is that missing tooth space. The adjacent teeth are left as is and do not need to be drastically altered to offer you a replacement tooth option. Also, because the dental implant only replaces and involves the missing tooth, it allows you the ability to clean around the implant a lot easier compared to the bridge option. With a bridge, the teeth on each side of the missing space are crowned, and attached to those crowns are teeth replacing the missing teeth. Because the replacement teeth are attached or anchored to the crowns, being able to floss a bridge becomes more challenging. With a dental implant, you can floss around the new crown just like you would any other tooth in your mouth. With a bridge, you now have to floss underneath the replacement teeth, which can be more challenging and make your oral hygiene regimen take longer. I have many patients come in who want dental implants, but they have some red flags or they have contraindications to treatment, making a dental implant a more complicated option. One big thing I see is patients who do not have enough room for the implant. Many times in these cases, the remaining teeth around the missing tooth have shifted so that much of that space that was originally present after the tooth was removed is now almost gone, or it doesn't have enough space to accommodate an implant and future crown. If this is you, you may require braces prior to implant therapy, or you may not have any good options to get an implant. An implant may simply not be the best option. Because the dental implant is placed surgically into the jawbone, you must have enough bone available at the surgical site to accommodate the implant. After natural teeth are lost or removed, the bone surrounding those teeth will resorb or shrink over time. If you have been missing your teeth for a very long period of time, it's very possible that you have lost a fair amount of bone from that area. Inadequate amounts of bone in the surgery site can make a dental implant more challenging, but it is not always a lost cause. With very little bone to place a dental implant, it would require the dentist or surgeon to find ways to bone graft in that area to provide adequate amounts of bone for the implant. In some patients, the amount of bone grafting necessary to facilitate the implant placement is so much that the implant becomes a lesser option. Your dentist should evaluate the amount of remaining bone as part of your examination. For best long-term results, you should have healthy gum tissue as well. If you are a patient who has had gum disease or periodontal disease in the past, this could compromise your dental implant. Gum disease is a process where specific strains of bacteria in the mouth cause inflammation within the gum tissue. The body's immune system fights this bacteria, and in some patients this can lead to bone loss around the teeth. Unfortunately, dental implants are also subject to the effects caused by this bacteria and the subsequent immune response. If the tooth or teeth you would like replaced is on the maxillary or upper arch and also in the back of the mouth, the maxillary sinus now becomes an area of potential concern. The maxillary sinus is an air-filled cavity that's primary function is to produce mucus. The floor of the sinus is the alveolar bone, the same bone surrounding the teeth. When a tooth on the upper arch in the back of the mouth is lost, the bone can resorb and the sinus can pneumatize or enlarge over time. This enlarging of the sinus places it in close proximity to the surgical site for the implant. If the remaining thickness of the bone in the implant site is thin due to the sinus floor, a sinus lift or an augmentation will need to be considered in addition to the implant. Just as the name implies, the sinus lift will place bone graft material into the floor of the sinus, thereby lifting the sinus floor, creating more bone for the implant. If you get an implant, you must 100% be committed to keeping it clean and healthy. This means your oral hygiene needs to be top-notch, to include brushing at least twice per day and regular flossing. Meticulous hygiene is necessary to ensure long-term health of the dental implant and your remaining teeth. When you get an implant, a surgery is involved. Sometimes that surgery alone is enough to deter some patients. The surgery is minor in the grand scheme of things, but it's still a surgery. This means that you need to be in relatively good overall health and not have any conditions or illnesses that put you at a higher risk for a poor outcome. Because healing of the implant is important to long-term success, things like uncontrolled diabetes and patients who smoke are at a higher risk of implant failure or complications. In one study, non-smokers had 98.6% success rates, and smokers had an almost 16% failure risk. Now, the amount of smoking also plays a factor. If you're a heavy smoker, say close to a pack or more per day, your risk of implant failure can increase to almost 31%. If you're a light smoker, meaning 10 or less cigarettes per day, you're closer to 10% risk of implant failure. If you're strongly considering a dental implant and are willing to pay the money for it, your best option is going to be to quit smoking first. Placing a dental implant in the anterior or the front of the mouth, especially in the smile zone, can be extremely challenging. Aesthetics becomes a factor in these situations, and there can be many things that complicate good outcomes. You could have an implant placed in the front of the mouth that is a success because it actually integrated and adhered well, but ultimately it's an aesthetic failure because the outcome compromised the appearance and smile of the patient. The surrounding gum tissue and amount of remaining bone is so important in this area that it can make or break a good outcome. If you are considering an implant in the front of the mouth, this will require an extreme attention to detail and should be something you discuss in depth with your provider. They will let you know their concerns and discuss options with you. If you're a patient who has ever thought about straightening your teeth or getting braces, this will need to be a consideration in planning your implant treatment as well. If a lot of tooth movement would be required to accomplish your goals of straighter teeth, the implant placement should possibly be delayed until after braces. If you're a young patient under the age of 20, an implant may need to be delayed until you're a little bit older to get the best results. The jaws continue to grow until about 15 years old in females and up to 19-year-old in males. Because the implant integrates and adheres to the jawbone, you want growth to be close to finish before placement of the implant. Ignoring this could lead to a poor aesthetic outcome and disappointment. Implants are a treatment option being placed by a variety of dental providers. In some instances, the implant may be surgically placed by one provider and restored or have the replacement crown placed on it by a completely different person. The starting point for a conversation about implants will be with your general dentist provider. If they place implants in their practice, it's possible that they will do everything you require. If your treatment is more complex or requires more of a multidisciplinary approach, you may be referred to a dental specialist who will also see you for some of the treatment. When looking for a provider to do your implant, you may want to talk to the provider about their past experience and training with implants. It may also benefit you to know about their past success when placing implants as well. One thing to keep in mind that many patients do not understand is that implants do not always work. You can be the perfect candidate for a dental implant and the surgery could go beautifully, only to find out later that the implant did not integrate and adhere with enough strength to the bone. In some of those cases, the implant just comes right out with very little effort. While there are a lot of possible reasons for failure, failures do occur and you need to know this going into the process. When an implant fails, it could be attempted again, or you may just want to look at other replacement options, such as a bridge or a denture. If you're serious about getting a dental implant, or multiple dental implants for that matter, you need to set up an appointment with your primary dental provider. Expect to get a thorough examination and radiographs. In some cases, they may even want you to get a three-dimensional radiograph or cone beam CT that will allow them to better visualize your anatomy and plan for the surgery. Make sure you understand the process of placing and restoring an implant with your provider. Dental providers can differ in their approaches and their techniques depending on their training and experience. An understanding of the time it will take from start to finish will help you make better choices and not be disappointed later in the treatment. Dental implants take time. Sometimes the implant placement can take one or more surgeries depending on the need for bone grafting, sinus augmentation, or other considerations. If other procedures such as grafting or sinus lift are required, this will also add to the expense of the treatment. A period of healing is required and can vary depending on the location in the mouth. Your dentist may offer you an option to have a temporary tooth placed onto the implant in some cases until the permanent tooth is fabricated, but this is not always a suitable option and could cost you more. This will be something you'll want to discuss with your provider. The last thing I will mention is dental insurance. There are so many plans available and variations of plans that you will need to check your plan and see what can be covered. I have found that many plans do not offer a lot of help when considering dental implants, and it could lead to an out-of-pocket expense. Make sure you talk with your dentist and find out what exactly your treatment will involve, and check with your insurance to see what, if any, can be covered. Alright, so that's going to be it for this video on dental implants. If you like this video, please give it a thumbs up down below. If you have not subscribed, hit that big red subscribe button down below. There will be more patient education videos coming soon. If you want to be updated every time a video is released, hit that little bell symbol down below and you will always know when something new is available. I want to thank you for your time and attention and your support. I'll see you next time.